It's a nice sunny day here. I have the sun shining right in my face. It makes it probably really washed out and bright on the video, but it's nice for me to get the sun. So a lot has happened. I haven't made a video in a couple of weeks. I went to Stanford recently, and I met with a surgical oncologist and a plastic surgeon, and that was really informative. Since then, I saw Dr. Durbis at Stanford, and he thought I strongly would need radiation. And then he also, I think he said, I might be mistaken, I can't remember how, this part's not as clear to me, that he said I would need chemo as well. But there's a good chance that he did say that, and I just didn't want to hear it really. But I haven't done any research on chemo and radiation because, well, I hadn't, now I have, at that time, because I was pretty certain I wasn't going to do it. And now I'm really considering doing it. I'm not really considering, I am going to do it if they tell me to do it, so that's different. I go back to Stanford on 4/24, so on Tuesday I have a meeting with 3 doctors. Dr. Durbis again, a medical oncologist and a radiation oncologist, and most likely they're going to have me do chemo and then surgery and then radiation afterward. And the plastic surgeon said, I said I wanted direct to implant, and he said all women come in and say that that's what they want, but he doesn't recommend doing that for various reasons, but normally a woman's not really aesthetically pleased if they do direct to implant. He prefers to do an expander, and he said in the case of radiation you have to do an expander. It also protects. They put it under the muscle, and so somehow, I don't really understand how this works actually. I thought I did at the time, but the radiation, well, I know what it is. You can't radiate the implant, so you can radiate a tissue expander. It's not a problem at all. So basically the tissue expander holds the place for a future breast while radiation's happening. So I thought he said something like the radiation, the expander actually protects your heart or something a little more, but I may have dreamt that or made that up in my mind. I'm not sure. So yeah, at first I thought, okay, for sure I'm doing a cold cap. I've heard from a friend up here, she just went through all this a little bit ahead of me, and she did a cold cap. She's got thick hair. I don't. I have thin hair. And she did a cold cap, and she didn't lose any hair. And she did more than Herceptin. I can't remember if she did TCHP, the common combination of the 4 chemo drugs, Taxotere, carboplatin, whatever, Perjeta, and something. But she didn't lose any hair, so I thought, okay, well, I thought I would do that. But it's so weird, the way that they do it. Penguin Cold Cap is one of the main companies that supplies the equipment that you would need. They charge per month, which I think is actually kind of shady because chemo might be 3 months. I don't know. It could be over an 18-week period, which would be longer, or it could be shorter. I'm not exactly sure what they're going to suggest for me, but it's probably more than a month. So you have to rent it out. So I was just assuming it would be 3 months. And I thought, God, $1,500? That's outrageous. So I looked up what it would take to do it myself. And actually, they have a scholarship, so I might apply for the scholarship. But I looked up what it would take myself, and basically they're these caps. It's like a helmet, basically a fabric helmet. You keep it in a freezer. They send you a little mini freezer that you can wheel around with you. You keep it in a freezer, and it keeps the temperature between -15 and -40 or something. They said when you first put it on, it feels like you feel like you're going to die, you know. It's so intense. It feels like you have frostbite, and a lot of people don't want to do them just because of that. But they said that once you have it on and then you change it, you get used to it, so you're kind of numb from it. But basically you have to put it on 30 minutes before, do it during treatment, and then change it every 30 minutes up through 4 hours after treatment. So it's a lot of changes. I think that's like, what, 8 changes, or I don't know, it depends on how long treatment is. So that's kind of a commitment. That's a really big commitment. You can do it with dry ice, but I guess it's harder maybe if, if you touch the dry ice, it burns you, I think. So yeah, I mean, I don't know. Part of me is like, screw it. Why would I do? Maybe I'll just lose my hair and I'll wear it like a badge of honor. It takes, I guess, about a month for the hair to grow back. I guess fuzzies, like little fuzzies, grow back in a month. And then after that, like by 2 months, you're starting to get some growth. But of course, some ladies lose their eyebrows and their eyelashes as well. And I don't really want to lose my eyebrows. I like my eyebrows and I like my eyelashes. But some don't. There's something called Revita lash that I was reading about. And I guess that might make it so that the eyelashes don't fall out. So it's a lot to consider. It's funny because it seems really easy to judge, like, oh, why would you care about losing your hair? Why would you care about how you look? What a superficial thing. And in a way it is. And in another way, it's like we all have things we're identified with, and we're identified with the way we look every day. And so when you lose your hair and you look different, it's a big deal. It's a big transformation. I remember I have shaved my head before. I shaved it when I was 19. And it's a different look for sure. Yeah, I look like a Monchichi, those little monkeys from the 70s or 80s. So I guess, let's see, is there anything else? Yeah, I feel really grateful that there's a few ladies I've connected with on Facebook who are basically ahead of me, like 6 months or a year ahead of me. So they're kind of, it's interesting the way you can guide somebody through, like somebody who gets a diagnosis now or is a couple of months in, I'm a little bit ahead of them. So it becomes a full-time job doing all this research and finding stuff out. I mean, I just researched iodine for a while yesterday. I mean, just one thing, And then I've been researching lately chemo because I hadn't done any of that. So it's looking like that's going to happen. On 4/24, I'm hoping I have a plan laid out, although I'm not going to be getting the chemo and radiation at Stanford, I don't think. I'd like to, but, it's a 4-hour drive one way, so it's pretty impractical. Well, the radiation I'm sure I would do up here where I live in Grass Valley at the hospital, and that would come after surgery anyway, but maybe the chemo I would drive down there for. That's a possibility, actually. Driving down every 3 weeks is not that big of a deal. But then I hope I have surgery scheduled, so I'm going to feel really good about that. One thing I learned, too, about the chemo that the doctor said is that the Herceptin, it's not that it doesn't work, it does work, but the efficacy is increased when it's combined with the other chemo. So somehow this cocktail they do, this TCHP cocktail is one of them. It's one of the common ones for breast cancer. They're more effective when they're used together. So he was really surprised that I had an oncologist that would even write an order for Herceptin only. Because it's not the standard of care, and I don't think they deviate from that at all at Stanford. And I live in a small community, and I'm sure they get all kinds of different people that want different things, so they were able to just give me Herceptin. And I just had my dose of Herceptin last week. I got the flu-like symptoms that I get, and really tired. You can see I'm laying down in my car, very tired. All right, that's my update, and I'll have another one probably after my visit on 4/24.